people actually have been infected, and we've been working with the police and transit workers and healthcare workers. We tested 25 downstate healthcare facilities. Downstate New York is where the predominance of the virus was, over 27,000 employees. So it's a very large sample. And what we found out is really good news, and one of the few positives that I've heard in a long time. When you look at the percentage of people who have the antibodies, which means they were infected at some time in the past and they're now recovered, of the healthcare workers, in Westchester 6.8, New York City 12.2, Long Island 11.1. That is about the same or lower than the infection rate among the general population. So Westchester, the infection rate among the general population is 13.8, almost 14. Westchester healthcare workers, it's about half of the rate of the general population. I mean, that is amazingly good news, right? We were afraid of what was going to happen. And the healthcare workers actually are at about the same or lower than the general population in that area. So that is, makes 2 points to me. Number one, our healthcare workers must be protected. They must have the PPE. We've been saying that all along. It was a mad scramble this last time to get the PPE. Internationally, it was a mad scramble for all of us. That can never happen again. We have to have the PPE. We have to have the stockpiles. We did an order that said every hospital has to have a 90-day supply of PPE at the COVID rate of usage. So we'll never go through this again. But it also shows everybody how important the masks and the gloves and the sanitizer are, and that they work. You know, it's not that the frontline workers get anything especially more sophisticated than the masks that people wear, the N95 masks. You know, they wear a gown, they wear a mask, they wear gloves. Masks work. They work. If they're working for frontline workers, they're going to work for people. Precautions of gloves and sanitizing, they work. Also, during this time, it's important that we protect New Yorkers who are facing financial hardships. So you have people who live paycheck to paycheck. The majority of people in this state live paycheck to paycheck. All of a sudden, the paycheck stops. The federal government issued a one-time payment of $600 unemployment benefits, but it's not making up the gap for many, many families. And they are struggling, and we want to make sure we're doing everything we can. We have a problem in upstate New York where many of the farms can't sell their product. You had a lot of farms that were literally just dumping milk that